So now we're on the second lecture. It's on feeling on loneliness, social isolation, and depressive mood states within the phases of the corona pandemic. We said they are less relevantly related to indicators of spirituality. I would like to start with a simple question. What did you do during the first phases of the pandemic? Maybe you're going to nature, walking in nature, perceived that nature's development. Maybe you noticed for the first time, wow, nature's developing, never noticed. Anyway, we were trying to avoid social contacts because during the first phases, we're in fear of potentially infectious others. That was the reason why we avoided persons we normally were very familiar with, because as social beings, we need contacts, and now we had to avoid contacts. Also, faith was shattered. During the Holy Friday 2020, we've seen religious speechlessness of the representativeness. Interestingly, the perception of behaviors of tumor patients as a vulnerable group during the first lockdown, we've seen 60% were irritated by different statements about the danger on the course of infection. Or they were worried to be infected with the virus to have the complicated course of disease. And they avoided visits to doctors because of the fear to be infected at the side of the doctors. There were also positive aspects. For example, they perceived positive changes in attitudes and behavior because of the pandemic. For example, more intensive perception of nature, conscious time of silence, and also social relationships. Others were worrying about the remaining lifetime. Several felt lonely. And maybe these perceived changes as a result of the corona pandemic could be seen in the context of post-traumatic growth as a process of reappraisal coping. It means in times of crisis, people change their attitudes to make new solutions or resolutions. You become for some time more conscious, more attentive, and more mindful. Only for some time, I'll show you. The Perceived Changes Questionnaire addresses different attitudes and behaviors. Nature, times of silence and contemplation, relations, interest in spirituality, reflection on life, and loneliness, and also the restrictions. It's published in Health and Quality of Life Outcomes. You can easily access it. It's for free. We started a continuous survey addressing burden, well-being, and these perceived changes. Here is the course of the disease in Germany. We have data from the first lockdown, the wave 2, wave 3, and wave 4, and now also wave 5. All these different waves, I will show you later on what are the effect of these waves on the different parameters. First, loneliness. During the whole course, we have a quite high number of persons who said, I'm lonely, I'm feeling socially isolated, 31%. The moderate level is 42%, and only 27 said, I'm not lonely, I have not a problem with it, I'm quite well with it. Loneliness was perceived higher by women, younger ones, and people living as singles, of course. The strongest effect was of age courses, the younger ones was a problem. There is also higher risk for mortality when you're feeling socially isolated, lonely, and living alone. Now we're applying these different factors on the perceived changes. The red ones are those who said, I feel lonely and socially isolated. The deep blue ones are those who said, no, I'm quite well. First, you can see here, feeling restricted was, of course, highest in those who say, I feel lonely. The fraction of life was highest in those who say, I feel lonely. While the others said, I'm quite well, have higher nature and silence perception, scoring a little bit better on spirituality, relationships, there's only a small gap, and digital media usage was similar to all of them. Of course, there is an association between loneliness and well-being. It's a strong negative association. Look at the detail. Those who have low well-being have high chance to say, I'm socially isolated, or a moderate side. On the opposite side, those with high well-being have a good chance that they said, I'm not lonely. So there's a clear dichotomy between these different groups of persons. Loneliness is strongly related to well-being and life satisfaction in an inverse way. And it's weakly related to all gratitude and only marginally negatively related to praying and meditation. It means you can't buffer loneliness by meditation or by praying. So here are the causes during the different waves of the pandemic. The red bars indicate the waves, and the others are the drops or the summer drops within, or intermediate drop or the summer drop. First, you can see here that well-being was quite okay during the first phase, and with the second phase, it starts to decline. And now it's a little bit increasing to the fourth waves, but it's not reaching the same level where it started. The same is true for life satisfaction. It's decreasing with the second lockdown and slightly increasing. And this is the feeling of loneliness, you see. With the start of the second lockdown, loneliness increasing to around 70%. Now it's starting to decrease a little bit, but still higher as when it started. Very important, during the course of time, the proportion of singles did not change. So it's a matter of feeling lonely, not of being lonely in terms of I'm living as a single. And here are the factors I've shown you. There's a strong increase with the second lockdown of feeling restricted, of course. There's a strong decline of spirituality. There is a strong decline of nature, silence, and contemplation. Only reflection of life was stable. So now this is an interesting, complicated table, I do know. Let's start simple. First we said, I perceive times of loneliness more intensively, and I enjoy quiet times of reflection. Let's say these are the positive ways to deal with these silent or lonely times. The opposite is lack of social relations, feeling cut off from life, and feeling lonely and isolated. So these negatively connotated perceptions have a strong, or at least moderate, negative association with well-being, with life satisfaction, and support through friends. And they are negatively related to these perceived changes, as you can see on the red light and the negative signs. Now switch to the positive side. Enjoy quiet times of reflection. It is positively associated with well-being, life satisfaction, and support by friends. And it's positively and strongly related to nature, silence, spirituality, relations, and so on. So the one group seems to self-determine coping with these phases. They said, it might be that we're restricted, but I try to make the best of the situation. While the others seems to have to endure it. They're suffering on loneliness, and therefore the associations are negative. So two different ways to cope with the same situation. So I try to sum up some things. At the start of the pandemic, people were more aware of relationships, took time for outdoor walks, perceived nature more intensively, took conscious times for silence, times of reflection, were attentive to what is important in their life, and so on. To overcome social isolation, digital media usage was intensified. They're using it to connect with friends, to participate in the world via internet offers. And surprisingly, standing and pausing and wondering awe and with feelings of gratitude was as a perceptive aspect of spirituality, was the best predictor for most of these positive changes during all the phases of the pandemic. So it means being aware that there is something more behind the dark side, that there still is something positive. When I try to find it and open the eyes or whatever, this was the best predictor. Yet with the onset of the second wave of the pandemic and the second lockdowns, things changed to the negative, as I've shown you in the dynamics of the changes. So some take-home messages. the COVID pandemic has changed the perceptions, attitudes, behaviors of people. Let's say it's post-traumatic growth in the first phase, only in the first phase. Later on, we may say it's defeat stress. If there is no prospect for change or improvement, then the resources may exhaust. And feelings of loneliness and depressive mood states are the result. There are different ways to cope with loneliness. First, the self-determined times of reflection, or the negative aspect is endured times of loneliness and social isolation, the sufferers. The consequences are different. One are trapped and the others go out and try to make the best of the situation. It is thus important to what extent persons can keep control over their life. Surprisingly, indicators of spirituality were of minor relevance to buffer this experience, although most of the publications said your spirituality is the best way to cope with the COVID pandemic. But if you look at the publications, you see most of them are theoretical reflection that spirituality in theory should be helpful to buffer. But as shown you, I will show you in the last lecture too, that several have lost their faith during the pandemic. So it's not that easy that with religion and so on, everything will be fine. The only difference is the perception of awe and gratitude. This resource was in help, a buffering resource. So thanks for listening. If you have some questions, feel free. Ja, ja. Also, nein, wir arbeiten an unterschiedlichen Standorten. Die Artikel, was ich jetzt als hier vorgestellt habe, das haben wir auch zusammen veröffentlicht. Die Sachen kann man gut nachlesen. Also wir arbeiten in mehreren Bereichen ganz gut zusammen. Oh, sorry, I've not translated in English. The question was whether we are collaborating. Yes, Klaus Baumann and we're collaborating in different projects. And this is the reason why our 4 lectures fit well together.
And maybe you can add Arndt Büssing. And he is at University in Aberdeen.
Near Dortmund. The question was, what are the professions? Klaus Baumann is a theologian, and I'm a medical doctor, and we are collaborating with our different perspective on the same situation.